I don't want to record it. So.
To see everybody? Yeah.
You should be able to just do that and have the meeting.
All right, just out of curiosity, can you guys hear me?
He turned his speakers off.
Yes.
I can hear you now.
I can hear you.
All right. Well, it's a little weird. We don't necessarily have wireless here at Remo, so it's going to be a little bit different. But anyway, we do have a quorum. We've been able to work through the roll, so we'll call the meeting to order and begin with our Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Previous meetings minutes are recording, so we don't need to approve them. Excused tonight is P.J. Keeler. Steve Neer. First up would be Tim with the Executive Director's Report.
Hopefully everybody can hear me okay. I'll try to abbreviate the best I can tonight due to these IT issues. I attended the ARMS meeting Thursday, June 20th, and that actually happened to be their annual meeting. Just a couple of notes from there. The ARMS Regional Medical Director, Dr. Fisher, had his contract renewed for another year. ARMS officers all had their terms renewed for another year with no opposition. And another note, ARMS is moving forward with participating in CARES. They're showing a big-time interest in that. And they've scheduled a meeting with the New York CARES rep, Susie Barnett. So I think that's encouraging. the consolidation of the Remo Arms Program Agency contract is moving forward. If approved by DOH, there'll be one contract that combines the Remo and ARMS contract funding, and that's for program agencies again. ARMS is on board with that move totally, and this should greatly simplify finances and bookkeeping for Dave in the other office. The new Remo Program Agency contract, but we're speaking of contracts, was finally approved. It's a 5-year contract that began on July 1st, 2023. We're now catching up with vouchering for the first 3 quarters of the year from 7/1/23 through 3/31/24. And if the Remo ARMS contract consolidation is approved, it should be reflected in this contract with the new year beginning 7/1/24. I hope that wasn't too confusing. My medical standard savior, Deb Cuffs, will be leaving at the end of this month. Not happy about it, but c'est la vie. We're actually actively searching for a replacement, and we actually do have somebody in mind, and it's a very definite possibility. We're considering a full-time employee for the position. You know, obviously it comes with a cost. Dave, PJ, and I met today to discuss our financial standing, and we believe we'd be able to support a full-timer, so I'd ask everybody to stay patient and stay tuned, and I'll keep everybody advised as things progress. Early summer training courses are in full swing. Our day class here at Remo, which is just actually ended about an hour ago, is at capacity with 30 students. And the only other thing I have is it's audit time. TBC auditors have set up shop in our conference room this week to do the in-house portion of the audit. And that concludes my report. Thank you.
Hey, Tim, this is Steve. Do you know the percentage increase in funding that's coming in the new 5-year program agency contract?
No, I didn't speak to that, Jim or Steve, because I don't know the exact amount. I know Ryan has alluded to that several different times, but as far as I know, none of the program agencies have been advised as how much that is. So for everyone else listening, rumor has it that our program agencies, all 18 of them, are going to secure some type of percentage increase in the program agency contracts, but the exact amount has not been announced yet.
So you have a contract, but the amount of money's not written in it? Yeah, Steve, the contract took effect last year. That
Okay. Increase hasn't been reflected in that contract because the new contract is so behind. It just got approved, but it actually became effective 7/1/23. That doesn't reflect the proposed increase that Ryan's been talking about. So the only thing I can assume is the new year starts 7/1/24. So are we going to see it 7/1/24? I'm not sure yet.
Okay. Well, I guess it's the way state contracting works, but it's very strange that you have a new contract, but you don't know how much money is in the contract.
Well, we have a new contract, but it's an old contract. You know,
Right.
like I said, it became effective 7/1/23, and this proposed increase hasn't become effective yet. So the only thing I can assume is that it'll become effective for the year 2 of the 5-year contract, which begins 7/1/24. I know that's right down the pike, you know, a couple weeks away, but we haven't been officially advised yet.
Well, thanks, Tim. Just keep us posted when you find out.
Sounds good. We have nothing from a chairperson's report, nothing related to issue discussions, and we'll go with Dr. Daly. You could do medical director or QI.
Why, thank you, Mr. Stairs. So figured I'd just bring all my stuff together at the same time since it's a little bit of a challenging environment here. I'm disappointed to report that unfortunately we got out of this legislative session with no movement on buprenorphine. Locally, that's a shame because we have a program obviously here that's ready to go for for several agencies that were very excited about participating. It's actually very expensive for a couple of other areas of the state where they actually had grants to implement EMS buprenorphine programs that they will probably have to give back, which is a shame, because these programs have been so successful. On a positive note, the blood for ground ambulances bill passed in both the Assembly and the Senate. I'm extremely excited about where that has the potential to go. At the same time, I would ask everybody to please make sure to walk, not run. I've already asked people to come together through the region to develop plans on a county-by-county basis for implementation of blood programs. There is not enough blood going around for every agency that would like to have a blood program to have a blood program. This is going to truly have to be a collaborative process that we'll have to develop really comprehensive regional planning behind in order to make it successful. One thing that every agency can do right now is to encourage their members to donate blood when there are local blood donation programs and blood drives, because there is a significant shortage to the blood supply right now. So that is certainly something that is coming, something that will be very exciting in terms of what we can bring to our patients. And right now is something that we just need to do some very, very good comprehensive planning in order to move forward on that. From a QI perspective, certainly we've had some challenges in the office, and really great to have Deb back for 15 minutes. I think it took a hell of a lot of stress off Tim, which was great. We did get through CARES and submitted a quality CARES report for 23, and we'll continue to support that on a regional basis. Look forward to expanding that successfully through ARAMS in 2024. Last thing from my perspective that I just want to review quickly, and I'm just going to do one or two of the high points, is just to mention that we do have protocol updates that are coming on July 1st. There will be a video up online relatively soon from me that will be accessible through the regional website. IT issues notwithstanding, I suppose. And we also have a much more comprehensive video that's going to be online from Dr. Cushman out in Rochester. The things that I want to make sure to highlight to folks, there will be very clear designation as to what is paramedic only, clear designation as to what is equipped and trained in terms of interventions. Things that are really important still to continue to remember is that ketamine may not be administered by CCs. And for folks that are wondering whether or not there's a potential to expand advanced EMTs into controlled substances, that is not a possibility because of both regulation and law. Other things that are keys just to continue to recognize. We stress again termination of resuscitation if we haven't had successful ROSC in 20 minutes. And one thing for all paramedics to remember is that suspected acidosis has been removed as a reason for giving sodium bicarb. The only reason to give sodium bicarb noted in the protocol is suspected hyperkalemia for cardiac arrest. The thing I would add to that would be somebody who has been in an agitated delirium state that goes into cardiac arrest. That would be a witnessed public safety cardiac arrest. That one, you may also give bicarb in, but that is not noted in the protocol. That is the only setting. So someone who is down, a long downtime cardiac arrest, that does not count as a reason to give sodium bicarb without a physician order. We also highlight that voice communication with a receiving facility as soon as possible after return of spontaneous circulation in a cardiac arrest, getting 12 leads early and before moving, and added push dose epinephrine to the paramedic protocol. We also added an anaphylaxis and allergic reaction protocol. It removes the norepinephrine drip and adds in that epinephrine drip is a medical control consideration. I'll have a lot more on these for you in my brief video that'll touch on these and guide us as we move forward. I'm certainly not going to read any more of them to you tonight over the meeting minutes. So if I have any questions for me, please shoot them across in the chat or bring them up. If not, it's back to Chairman Stairs.
Dr. McHugh, REMAC or academic?
No, thanks. So actually had a long and relatively productive meeting, which was nice. So approved nitrous oxide for paramedic use. Previously it was only for AEMT use. We did discuss the blood possibility and how that would go. Had a long discussion about the RSI reports for airway and looking to expand that next year for all agencies with a little bit more reporting detail to get some more useful information out of that. We did discuss collaborative protocols, particularly looking at the more wilderness and sort of remote access or limited access protocols for the rangers to use as well. And then went over the CARES data. I think that's most of what we talked about.
Sounds good. Any questions for Dr. McHugh? Seeing none, PJ is absent. Everybody has a copy of the Treasurer's report. CON committee did not meet, so we have nothing from that perspective. There are two New York State Department of Health disciplinary actions. Brent Allspach of Pine Bush, New York State DMT number 478335 had his certification suspended for 1 year effective 5/6/24. The suspension is stayed pending no further violations for a period of 3 years. Oh, third, sorry. Carol's helping me. Good secretary. Suspension is stayed pending no further violations for a period of 3 years. He was assessed a civil penalty of $2,000, of which $1,000 was stayed for violations of Part 800.16A1. Brent Taylor of Geneva, New York State EMT number 498549 had his certification revoked and annulled effective 5/21/24, and he is not allowed to seek any recertification for violations of Part 800.16A5. And Laura Mastriuno, Greenville, New York State EMT number 194997, surrendered her certification effective 6/5/24 for violations of Part 800.16A2, A3, A4, A9, and Part 800.15A1 and A3. Course applications. There is one to be read into the record. That's for Greene County EMS Council. And they have an EMT original starting on September 9 of 24. No correspondence. The executive committee did not meet. That would bring us to Steve Kroll and Finance.
Hi, Jim. I have no report from the Finance Committee other than what we talked about earlier, where we worked at the State EMS Council pretty hard with the program agency leaders to get an increase in funding. And we're waiting to see what it will be for 2024 and then each of the other years of the contract.
Sounds good. Anything, I mean, that was kind of from New York State EMS Council as well. Do you have anything additional from that?
Yep, I sure do. The next EMS Council meeting is not until September. However, a number of things going on. Dr. Daly did mention the blood bill, and we're pretty excited about that. Two other bills passed in the legislature during this session. One of them has to do with the treat in place and trips to alternate destinations to be paid for by Medicaid. Like the blood bill, it was passed in both chambers and we're waiting for the governor to sign it. Once that happens, the rules will be put in place that will allow us to be paid for the treatment we render in place to Medicaid beneficiaries, including things like RMAs and doing evaluations of car accidents. And so that will be a direct benefit to the agencies that do all these things today and don't get paid. And it'll also allow us to do some new things like the telemedicine that some of us were doing prior. And there are some groups out there that do those types of in-home visits that are watching what happens in New York and considering whether to come in and work here, like the UCM Digital Health Program that several of us were participating in. The other bill that passed in the legislature is the tax-related bill, has to do with the 10% tax exemption. And it's kind of a specialty thing, but the 10% tax exemption that municipalities can give right now, they currently can only give it to volunteers that are volunteering in their community. And working, so the change that's being made will allow the municipality to give the tax exemption to a resident who volunteers in another community. So its implications for ambulances, if somebody is part of a, you live in the town, but you volunteer 2 towns away because maybe your town doesn't have a volunteer ambulance, they'll be able to give you the tax exemption. So it just expands the number of people that will be eligible for the tax exemption. And that also has not yet gone to the governor for signature, but we expect that that will pass. We're a little disappointed that the essential service bill did not pass this year. It passed in the Senate, not in the Assembly, and we'll be working on it moving into next year. Just 2 dates to put on everybody's calendar. Sorry about the dog backing in the background. I hope it's not too bothersome. The New York State EMS Memorial has been rescheduled, and the new memorial will be completed. And so that's going to be September of, let's see, where's the date? I don't have the date right in front of me. I slipped up. Give me 1 second. New York State EMS Memorial. I believe it's September. Come on. It's been moved to September 19th at 2024 at 11 a.m. And of course, our region being the closest to the Empire State Plaza is always the one that brings the most people to support the memorial. So I encourage you to put September 19th on your calendar and send an ambulance down to be on the plaza. And lastly, the Vital Signs Conference is coming up this year. It's going to be in Rochester, and that is October 17th through 20th. Thanks, Jim. That's what I got.
All right. Does anybody have any questions for Steve?
It's not a question so much as I wanted to chime in and add from the chief seats as I could about Senate Bill 8486. Steve, can you hear me? Rich Brandt.
Yes, Rich, I can hear you.
Okay. That bill did pass both houses. This is a treatment in place bill, and it did pass both houses. It has not yet made it to the governor's desk, though, and that's important. And the reason I say it's important is that those of you who have any influence, people who are maybe your lobbyists who are on the phone call perhaps, and others, it is very important that she signs that into law before October 1st. Because the way that the bill is written, if the law becomes effective on the 1st of October in the year following her signature. So, yeah, or the year of her, yeah. 1st October, 1st following her signature. So if she signs it on September 30th, it becomes law. October 1st of this year. If she signs it on October 2nd, it does not become law until October of 2025, so the year is lost. Yeah. There's also another hurdle to be crossed with this is my problem. I'll be working on this on the OHIP end. We need to do what's called the CMS State Plan Amendment to get the federal participation, which is a requirement to the law as well. That's a 50% federal match on dollars. So we'll be pursuing that, but we can't pursue it until the law is enacted. So I'm kind of in park right now and doing the CMS spa. get the matching funds.
Thank you, Rich. There will be a coordinated campaign by the United New York Ambulance Network and New York State Volunteer Ambulance and Rescue Association at some point this summer to get people to contact the governor's office and ask her to sign the bill. We're waiting for the right time because we have to figure out when the Assembly and Senate are going to send it over. And so that'll be coming to an email near you.
Cool. You and Andrea, I assume, are watching that very closely.
Yes. Correct.
Very good.
Thank you.
Nurses, Anne Marie Cross?
Okay, can you hear me?
We can.
Okay, great. So we met on May 16th. We had a good representation. Ellis Hospital was on the call. Albany Med Adult ED and Peds ED was represented. Glens Falls Hospital and Saratoga Hospital. And Dave Galati was on it as well as Steve Meehan. I started by giving just a brief overview of our last meeting where Angie Cunningham from Placera reviewed the functionality of Placera and the differences with the upgrade. We talked a little bit about LifeNet being due to expire soon, so we'd like to explore that option of going with the paid version of Placera. So at the next meeting, we're all gonna, they were gonna look at their contracts to see when it would be due so that we could move forward with that. The next item on the agenda, Dr. McHugh gave a physician medical update. He said that the CARES data was in, and I did receive a link to the 2023 annual report. I'm going to send that link of the website to the nurse committee prior to our next meeting so that they can review it and we can discuss it at our meeting. We talked about transfers and issues with that. No specific issues were noted, except that everyone is still experiencing long delays in getting ambulances to transport the patients. Steve again gave an overview of the MIST form, hoping that other hospitals would jump on board with that. Dr. McHugh said that they are using it at Glens Falls and it is working well. We'd like to just have this branch out to the other hospitals, especially with St. Peter's and Albany Med. The next thing we talked about, Albany Med actually had brought up that there's just a lot of pumps. It's just more of an FYI. A lot of pumps that were being left at Albany Med that need to be picked up from EMS, from the EMS room. We're going to include this in all the minutes to send to everybody. Plus, I did reach out to a couple of the other nurses who were not there just to let them know ahead of time, and so that they could make arrangements for them to be picked up. Laura Haney from Ellis talked, this was at open discussion, just about the number of adolescent psych patients that are being brought in for psych evals, that those numbers are increasing. Everyone that was on the call experienced the same thing with parents refusing to pick the patients up. They drop them off, and this is creating lots of issues, increased volumes in their crisis units and patients waiting. She also talked a little bit about how we should put that patient in as an OBS so that the ERs can get paid because we are still providing care. And that we stated that our next meeting is going to be, we're not going to meet in the summer, so we will meet on September 19th. And that concludes my report. Are there any questions?
Sounds good. Thank you, Anne Marie. PJ is excused, so no MCI. Lynn Kane membership.
Good evening. We have no renewals at this time. And I'd like to remind everyone, if you don't currently have an alternate, now would be a good time to make it known so that we can bulk up the number of people that are participating.
Sounds good. You can have Tim probably send that out as a reminder.
Thank you.
Nominating? Thank you. Nominating?
No report.
Aye, very good. Awards, I'll get out of your way.
Okay. All right, so everybody should have already gotten the packets, the nominations, for the award, nominations for this year, to kind of go through and start making selections. After this meeting, Tim's gonna send out the survey, that's gonna have those folks on it, and, we need voting done, by noon on Wednesday. So if you can get in and cast your votes, for the nominees for this year, so we can get those into the state, by the end of the week, so. That's all I got. Everybody should have gotten all those packets.
Carol, this is Steve. I know you received a few nominations that came in different ways. I want to make sure that they were included in the packet. Dr. Hayashi, one from an EMT, Ashley Chickenelli, and then one from Dwaynesburg. Did all three of them get it sent out?
Yes,
Because I don't think
as far as I know, they,
I didn't think I saw the Dwaynesburg one. Can you just make sure you check? Because I think we've got to give everyone fair consideration.
okay, I think I sent it out last week, and then, Mike said that, Tim sent it out today as well, so.
Okay, just want to make sure
Um,
everybody sees every single nomination. Otherwise, we have a problem. Thank
Right.
you.
Okay, they'll be all on the survey, so if one shows up on the survey that you didn't receive, please let us know, but I believe they've all gone out.
Okay.
The one
Thanks.
from Dwaynesburg was sent through the portal, so it looked a little different than the others.
Right. Thanks, Carol.
Okay, you're welcome, thanks, guys, so vote early and vote often, I guess, right?
County reports, anyone from Albany County? Columbia County?
Nothing significant to report from Columbia County, and I had a text conversation with Steve Neer, who was unable to attend. He stated nothing significant other than they were in the midst of their EMS review from, I believe, Fitch and Associates, similar to the review that was conducted in Columbia County. And I believe that is completed, and they're expecting a report sometime in July.
Okay, very good, thank you, and thank you on behalf of, Steve.
No problem.
Rensselaer County? No. Saratoga County?
Nothing to report, Sir.
All right, that was Tracy Weir, thank you, Tracy. Schenectady County, Jim Vina?
A few things. We've got a new chair that was voted in last month, and that's Peter Brody. Schenectady County is also actively searching to hire a full-time EMS coordinator. So if anybody's interested, there's instructions on how to apply and the application on Schenectady County's website. And I think the only other thing relevant is there was a brief discussion on BLS crews packaging and transporting patients in accordance with protocol rather than waiting on scene for ALS to arrive, which can sometimes be delayed. And I think that was it.
Very good, thank you. Just as a point of record, somebody came in by phone last for 1419. We just want to confirm who that is. Oh, you got it?
No, I haven't.
That would be Rich Felucci.
Perfect, thanks, Rich.
That was a guess, but we didn't want to wing it. We actually covered both things under new business. Anyone have anything under old business?
I just have one more thing to say, if you guys have a second. For the awards, we've moved Michael Prezioso from BLS provider to the EMS, excellence in EMS quality and safety, just because it seems like that's a better fit for that actual award. If you read the write-up on him, he created basically a peer support system up in Saratoga County, because he's also a psychologist. So it seemed like it fit better in that category. So, and Mike McAvoy agreed to the change, and when if and when he wins it, we can submit it to the state under that category. I wanted to let you guys know that.
Sounds good.
Jim, if I may, I've got one question.
Sure.
I know we discussed this, oh my goodness, it was quite a while ago. I think our borough was also involved in one of the conversations, but, kind of curious if there's a way to utilize Pulsera or another avenue to, be able to easily disperse to all of the providers in the Remo region, the current and accurate capabilities of the facilities. We found over the past few weeks, hearing mostly through the grapevine and then finding out after a patient has been brought to a particular facility that the hospital that we've gone to, the capabilities at that time maybe aren't available for a particular patient. And I can't remember really where that conversation was left off. I don't know, again, if that is something that's capable in the eyes of Pulsera. It'd be beautiful to have that all easily delineated on one platform. But I think the capabilities of some hospitals, they seem to vary from different times for a number of reasons, I would imagine. Staffing to be probably one of the most important, but having that information in a way that it can easily translate to the crews that are in the field so that they can make informed decisions regarding transport with patients. I think that's something that hopefully the region can try to aid with.
Yeah, so Steve, I think that's a great idea. I think there's two things that fall into that. The first is what the capabilities are. Those are certainly things that can be put up on the Pulsera dashboard by that hospital themselves, and that's where that would have to be controlled from. The other is what the hospital is going to consider in terms of where their capabilities lie or what their capacity is, and that's going to be very institution specific. But those are factors that we'll continue to encourage. It appears as though there will be an expansion of some of the capabilities of Pulsera within the region. Just hearing some stories about that now. I have not gotten any formal confirmation from some of the facilities, but I'm excited about the opportunities for improved communication between the hospitals and the providers in the field through that platform. So I certainly hope that it continues to grow.
That's encouraging for sure. I hope that's something that can continue to flourish. And I can understand that maybe some facilities don't. Airing your dirty laundry is probably not the correct term to utilize, but you may not want to publicize certain things that you don't have the capability of doing during different periods of time. But it definitely, that information is critical to providers in the field when making decisions.
No, I think there's two things, right? The other is that it's bidirectional communication. So if a patient's on their way in to a facility whose CT scanner, for example, isn't working, and they have a head injury and likely will require a CT scan, and that's what the nurse answering that Pulsera communication recognizes, they could confirm that with the providers in that emergency department and then send that information back out to the incoming ambulance so that the ambulance could make an informed decision with their patient.
That will require education for nursing because for years they've been told that they can't say anything that would discourage someone from coming, but that is clarification capability, so would be allowed under MCALA. But I think that needs education to nursing to be able to do that.
Which is exactly why, Rob, I said that they should clarify that with the provider working in the emergency department to make sure that there were no mistreads in the nature of MCALA.
So when we were building the Pulsera, the initial rollout, we had built in MIST type forms at each of the hospitals so that providers had kind of a format to start with. I know we've kind of gotten away from that, but that information is still getting relayed in those different patient channels. But in that hospital dashboard where you can see their current status and what color they are, and they can put comments in them, right there, we could, as a region, create a standardized form that's more like a chart that has each of the capabilities. And then the hospital can simply just update that when they're updating their Pulsera every 6 hours. I guess at the St. Peter's hospitals, they do it every 6 hours. So that may be a worthwhile thing because it'd be standardized messaging across all hospitals for all the Remo region. And the providers, the EMS providers would be knowing before they even go to their patients what each hospital can do.
That's certainly very reasonable on on face value, Dean. Unfortunately, some of those discussions we've had with the hospitals in the past, and the hospitals were unwilling to participate in any great depth in terms of what their actual capabilities were.
Like I said, I just wanted to throw that out there. Hopefully it's something with the further advancements that we do with Pulsera that can bear some fruit and providing, well-needed transparency of capabilities to all of our EMS professionals.
Agreed, and bidirectional communication should be just that. Discussions about making sure that we're providing optimal care for our patients and we're going to the appropriate destination for the patient that's being presented to each of the hospitals.
Yeah, the only kind of to piggyback on that is it seems that a lot of, the conversations that I've heard from other organizations and ours as well, sometimes the destination conversation is had, with family or at the residence or wherever that is. And then the connection with Pulsera is made while en route to the hospital. And, then the crew with that bidirectional communication is finding out that a particular procedure or something can't be conducted at that facility. Now we're a little behind the 8 ball, where I fully agree with you. I think the bidirectional communication is where you're going to find that information out. But some of these transport decisions are made well in advance of that link being started.
Agreed, Steve.
The other item that actually was after Daly mentioned me as we were doing our dance around the phone here is, I don't know, probably a decade or more ago, we had a retreat to discuss Remo and its course that relates to the future. So it probably wouldn't hurt to get that back on the agenda now that we're past the pandemic and other stuff like that. So maybe we'll try and explore some opportunities for a fall retreat, even if it's only a brief retreat. But it probably wouldn't hurt to take a look at that again and again, since we are now have the ARMS as part of us. That should be an interesting conversation and start of a course moving forward. Any other items from the floor? All right, seeing none, our next meeting will not be until September 23rd. So I could break into the See You in September song, but I won't. Other than that, we'll call for a motion to adjourn.
Alan, I'll make the motion.
Motion by Carol, seconded by Dr. Daly. Anyone want to oppose or vote no? Seeing none, we'll close the meeting. Again, thank you all for your patience with our little technology challenges here this evening, and we'll see you in September.
You're trying to do it going back and forth. Reaching around. IT guy, he'll be here Thursday. Because it's very strange.
I don't know why it was
not,
but we should tell them we agree. It doesn't seem to want to stop recording.
It may just, if it doesn't, it may just end automatically.
I was going to say, if you end the meeting, it'll obviously stop the recording, you would think.
And did you hit meeting in?
Did you shut down your phone line as well?
Oh, yeah.